Good evening to everyone. Hopefully everyone is doing well. We have about 35 more seconds before we officially start. But if you would, if you have not placed your name and campus in the chat, if you have not placed your name and campus in the chat, check your screen name, make sure that your first and your last name, make sure it's correct, that it matches Fortis's roster. And if it doesn't, on the way out my view, you can actually go to your square and there are three little dots. I think they call them a ellipsis or something. You click the little three dots, a menu will pop out, and then one of the selections that you will have will be renamed, and then you're able to change your name at that point. So make sure, good evening to everyone. It's official start time. If you have not placed your name and campus in the chat, please do so. And also change your name so that it appears your first and your last name as it appears on the roster. As we mentioned last week, in the event that you're going through a name change and it has not officially occurred, just leave it. Make sure that your name appears how it appears on the roster because we don't want attendance to be in question. So welcome to week 2. We're almost there. Only 10 more weeks to go. And I tell you, I know we're saying it's just week 2, but time will really, really go by fast. So just make sure that we just some reminders. Let me pull back up our during orientation week, everybody was just trying to get in, switching sections, just making sure everything was done. So just want to hit some highlights from our orientation week. Remember to communicate early in the event that, if you think you're going to be late because the policy does require prior approval. And in the event that you do not complete that assignment by that date, it automatically pushes to 0. But remember, you have that 1 to 7 day to complete that assignment with that prior approval. And so we'll go in usually around the 8th day to go in and see what work was actually done. But if you don't complete it by that initial date, it pushes that 0 out. But then, if you've gotten that prior approval, then we'll go in usually around the 8th day and pull it out. We've already pulled your grade out. We've already talked about making sure that you're on camera. In the event that you have to walk away from the camera for whatever reason, just make sure you put a message in the chat to myself. You don't have to send that message out to everyone. Make sure that you have your full name there. Let's see here. Remember, exam 1 is coming up. For the most part, several of your classes is next week at week 3, and then some classes is week 4. But remember the 2 devices. Exam South should be open. I think it opened up today. So we'll push out that practice exam. Make sure that you go in and complete it. Make sure you go in and complete that practice exam. On exam day, make sure you have those 2 devices, your charger, and let's see what else. In the event, remember there's only one attempt at that exam. As always, if you're having connectivity difficulties or any other issues, please let us know prior to completing that exam. Because after that, there's nothing that we can do. In the event that you think that you need any of your exams proctored on campus, go ahead, put that email out. Some people have already. If that's what you need, it's an individual thing. So make sure you put that out. That 72-hour notice, at least a 72-hour notice in writing. Include myself, your campus dean, and Dean Brown in that email. If you have accommodations, make sure you've sent those out because we will need to get those accommodations in place for you. Just some reminders here. Then remember for your lesson assessments, remember, yes, you have that, that leeway in the event that you do not complete it by the due date. But the only thing with the lesson assignments, you can repeat it and you have up until that due date. But after the due date, you get that prior approval and you complete it after the due date. That first attempt is what is actually graded. And then that 10% deduction applies to that. So just every point matters, you all. You can always get things done before that due date. That even as an hour early, a day early, just go ahead because you want all your points. I think we have nothing on this slide. I think that was it. Just reminders. And then remember, you get your professionalism evaluation, what includes your attendance, communication. Remember, we use the chat. We do, everyone will say, come off mute and respond. Small group, whole group. Just remember that professionalism grade. That's every week. All right. So those are our little housekeeping reminders. Here, let's look at our announcements and everything. All right, so let's look at this exam schedule here. Pull this up. Our class is on Wednesday. We do not have any holidays that affects I don't think. I know exam one, it doesn't affect us for exam one, but if you all, and I'm sure you've heard, if you have a Monday class and if you have that an exam on week 3, you should have received alternate instructions. Okay. So the review that we posted it already, the one that we have the recording of. Share my screen here. So you do have a few that's coming up, but at a minimum, commit to going back through your classroom recordings, our content. Week 1, you can fast forward through most of that orientation information because that's not going to be on the exam. Fast forward to the content part, but you can always refer back to that orientation information if you need that. But for the exam, you're going to need to fast forward to the content part. We have already started exam reviews. The links that we have, there's only one so far, and I posted that one. Now, this is in your announcement section just to show you the different exam reviews, the live ones that are coming up. We've already had, was one actually going on right now. So there are 3 that have occurred, but I've only received 1 link. And so these are some that will occur, at a minimum. Just, go to make sure you're looking at the recordings and also your classroom recordings. All right, let's go back here. So for any of your course shells, we did put a reminder if you need information regarding office hours, the course date and time, the Zoom link. Those are on that syllabus sheet that's in all of your course shells. So that is there. It's usually pretty much like the first 1 or 2 announcements. So you can go back to that if you need to refer to that. We were just asked to remind everybody that that information is there. Okay, so let's look at the exam 1 blueprint. Okay, so we're gonna look population health, health promotion, those different trends and issues. And then last week, we talked about those theories and aging, health promotion, health maintenance, maintaining that fluid balance and nutrition. What are those foods when someone is needing extra protein? What are those foods? So the exam will include that, and then meeting those safety needs of the older adult. Okay, and this blueprint is here, and this is all in your announcement section, just referring you to it. So this is the blueprint here. So jot down what you know, your notes, and then those that the concepts that you still have, don't look at the key until you actually work your way through it. Don't look at the key yet. But those concepts that you still kind of struggle with, or, you need a little bit more fine tuning with, make sure that you start with those, reviewing those first and put those at the top of your list. And then we do have Professors McCaffrey here. We do have her review recording. So far we have 1, but as those links come in, we'll post them in the announcement section. So that's where you will find those as they come in. And they're all different days and different times. So we know you can't go to all of them, but we try to, mix them up so that we can accommodate schedules. But at a minimum, commit to looking at the recordings in your classroom recordings. All right. I think that's all of our housekeeping. So let's complete the rest of our content here for exam one. Okay, we're gonna start off here. Sure. Share my screen. So population health is health outcomes of a defined group of people and how those outcomes are distributed throughout that group. So you have this group of people, it could be the people at the community center, the people that live on this side of town, the people that go to that work at this particular place. It's just that defined group. Public health has an emphasis on disease prevention. If we can prevent it, then that client more than likely will have that optimal level of health. We can prevent that disease process. And so be thinking about those things that we do to prevent diseases. You know, it's flu season now. What are we asking people to do? We're reminding people about that respiratory hygiene. Cover your mouth, wash your hands. If you're sick, stay away, stay well hydrated. Health protection and health promotion. Usually during the summer months, you hear those campaigns that come out about staying hydrated so people won't have the heat strokes and the different heat injuries. So public health use evidence to benefit society using supported government agencies. And so these are agencies too that I don't know if you all have rotated through any of those, but you can, as a nurse, work in these government agencies. For example, the health department. And so a lot of their programs are centered around disease prevention and health promotion. And they do to define a group of people that some of their programs are specific to like the children. They may have, I know I saw like a billboard maybe this past summer, maybe the summer before then, it was specifically for children, making sure they got their fruits during the summertime. They were out of school. So that was that defined group. Here lately, I've seen one about the RSV. We're not for vaccines, we're not against vaccines, but we want people to have the information out there so that they can make an informed decision. We support their autonomy. So RSV was generally known for the young, but now the elderly is affecting them as well. So they're just making people more knowledgeable. Hey, we're seeing that it's affecting the elderly as well. And here are the things that you can do. It's a vaccination, at least putting that information out there so that the defined group of people would be, that 65 and plus population. Community health is a collaborative enterprise that is comprised of multiple sectors in that community, as well as all those that's on that, and it takes an interdisciplinary approach. So multiple moving parts that uses public health sciences and evidence. Remember, we're looking at the latest evidence. We're just not haphazardly just picking things to do, but the evidence suggests that this is what we should be doing. So, and also this helps us to work with those communities, and hopefully we have those communities living at that optimal level of health, and it will benefit those members of that community. So global health uses evidence-based disease prevention, health protection, and health promotion on that global scale. And that's, of course, accomplished through collaborative, multiple interdisciplinary parts, several moving parts. Population health management are efforts by healthcare organizations, accountable care organizations, and insurers to keep individuals as healthy as possible for as long as possible. So something that comes to mind, the insurance companies, they have all of these programs too that helps people is they have primary programs and they have those tertiary levels. Well, they're out there to help people manage if they have a disease process going on. They have like those check-ins, they have like those health coaches, and then to prevent, they let you know, well, hey, we can come out and give you your flu shot or at the community center or at the adult daycare. So it's a multiple disciplinary approach. So health promotion focuses on improving knowledge and assets. Is this a true statement or just false? Put it in the chat. Put a T or F. Do we agree with this? Health promotion focuses on improving knowledge and assets. So what is this assets that they're talking about? Yeah, an example could be, well, hey, we're letting people know that, hey, they do have an adult daycare center that has, 3 meals, during the day, breakfast, lunch, and then they offer the early, maybe the early supper. And so that's accessible. That person does not want to cook meals, or it might not be in their budget to have all those meals, or they just want to get out and be interactive, keeping themselves active, going to that adult daycare center. Health promotion, let's see what we're saying, focuses on improving knowledge and where's my little bar go to? And essence. Is this true or false? Okay, looks like we have our truths. Yes, this is true. It's a true statement. Okay. All right. So I pick on Nurse George and Nurse Lisa. And if someone's name is that, I'm not picking on you. It's just I usually use the patient in room 201, 202, and 203, and then Nurse George and Lisa. So here it is. Nurse George tells Nurse Lisa the following. And then we want to know, do you agree or disagree? Nurses in public health work to assure conditions that will allow for optimal health. This is George and Lisa, they're talking. George tells Lisa, do we agree with this statement, you all? Do we agree or disagree? So in the chat, just put an A or D. Nurses in public health work to assure conditions that will allow for the patient's optimal health. Let's see. What are we saying here? Optimal health. Okay. Looks like, okay, Miss Savannah, what you say you disagree? What part? What word should we use differently?
I agree with that nurses, can you hear me?
Yes. Mhm.
I agree that nurses in public health work to emphasize prevention and education, but as far as assuring conditions that allow for optimal health, I feel like a lot of nurses don't have control over that. The only thing they can do is educate and help prevent things. But as far as assuring conditions that allow for optimal health, I don't.
But that is what that is. So it's not like, okay, for example, you're saying like the example that I just gave about the commercial about the RSVs, like informing the elderly 65 and plus, hey, in the past we just thought about this affecting children, but now it affects the elderly. And so that information is there for them. It's not like we're keeping that information to ourselves. It's out there. Are we going to make sure that every person tunes to that channel or go out and get that vaccine? No, we're not going to do that, but we're just making sure that information is out there. So I see what you're saying. Sure, it is a kind of a positive word, but we're just making it available, and it's on them to do what they want. Because even though, for example, think about I don't know if you rotated through the long-term care facilities or either behavioral floors where some patients, it's time to get a bath, to assist with that, that bathing. If they refuse, that's on, they have the right to refuse, but we offer. So I'm sure it might be not the correct word, but as long as we are making it available. And then the whole point of it is for them to be, allow for the optimal health. Even though we put that information out there about the vaccines, even though we offer the assistance with the bath, we offer the tertiary interventions so that that client can help manage their disease process. Doesn't mean that they want to do those things. But that opportunity is there to allow for them to be at the optimal level of health. And so they also emphasize prevention and education. Okay, let's see what Nurse George and Nurse Lisa talking about now. Let's see. So we got Nurse George tells Nurse Lisa they are completing scoliosis screenings today at the local community center, or they're just completing any type of screenings. Lisa states, we should be able to complete at least 100 screenings today. I hope Dr. Bob and Dr. Joe have their appointment books open for follow-ups. I meant to put podiatry screenings or foot screenings or hearing screenings, something else besides scoliosis, because I know our population is geriatric. So I was going to change this to something that, because, usually this is the children, but that's really not, I don't want to give away. So don't focus on scoliosis. I will give you that hint. So Lisa states we should be able to complete at least 100 screenings today. I hope Dr. Bob and Dr. Joe have their appointment books open for follow-ups. The question is the above scenario appropriate? And I just come up with these things, y'all. And so it's not like it's in your, the concept is coming from your required readings. So look for the main concepts there. And is this scenario appropriate? So we got two nurses talking about screenings. And then they're saying that's just one piece of it. Because remember, it's several moving parts to these nursing stuff, you all. Then after they do the screenings, they're saying, I hope these doctors can get these people in for their follow-ups. Is this an appropriate scenario? And you can just come off mute and say yes or no.
No.
Okay.
No.
And so why would you say no? Please discuss. Share.
I would say no only because it's not very professional to say. I feel like there's certain things you should say, but to assume that they will have a follow-up is not the right idea. I just
Okay.
wouldn't say that.
Okay. So just put a pin in that part. Anyone else? Do you agree or disagree? Is this an appropriate scenario?
I'm on the fence. I kind of agree because out of 100 people, you just feel like somebody is going to have a screening that's going to be positive, where they're going to require a follow up.
So what is the whole point of doing screenings, you all? To see what?
If something is wrong,
Exactly. So that they can do what?
have a follow up or be
Exactly.
seen. Yeah.
So yeah. So is this an appropriate scenario? So is this appropriate? So the
Yes.
whole idea was screen. Last remember I told their test taking tip. You have these scenarios like the sun is shining. They planted apple trees, all this stuff. But remember, what are the concepts? So the concept was screening. So why do we do screenings? No matter what this word was, scoliosis, hearing screenings, whatever kind of screening. What if it said that we were doing TB skin tests? That's a screening, right? Because we're screening to see if that person has been exposed. So in the event that they have, what would they need? They would need a follow-up. So this is an appropriate scenario because when we do screenings, we're trying to detect, to determine, to see if this person has an injury, a disease process, or something going on that they need to follow up with. So this question was about pretty much the levels of interventions, primary, secondary, and tertiary, and then, what is the purpose of doing that? We following that? Is that, do I need to give another example? So it is health promotion. It's health, it's prevention, it's preventative care. And so, and how is it prevention? Well, we're going in to see, well, hey, people may not realize that they need their hearing checked or their feet looked at or their eyes checked or, so once they get there, it's like, okay, well, we got these are our findings. Well, what do I do? That's why, a lot of patients will say, well, they told me all this is wrong with me, but what do I do from here? So that's that tertiary part where we need to follow up so we can give them some tools, some resources so that they can manage. So that follow-up is needed. Now, sometimes, it's still going to be up to that patient to go and, do the follow-up and all of that. But screenings are done to detect, to determine, to see if there is something that client needs to follow up with. Thank you all for sharing. Remember, this is a safe space. So in the event that, things are answered, not so correctly. We're gonna get you down. We're gonna circle back. So it's okay. Because thinking out, giving your responses, it kind of helps. It does help you think through. Well, okay, wait a minute, let me line it all up. And that's another thing, you all. The dry erase board or the clear sheet protector. You need that or your marker to write on. You don't have to have it, but they discourage the paper. So that is something that you all can use too to gather your thoughts. Make your little columns. Identify what that concept is. What is this question really asking me about? This question really wasn't about Nurse George or Lisa. It was about the screenings and why we do screenings. Really is what this whole scenario was about. So screenings are done so we can see, so people can follow up. We'll let them know, and it's on them to follow up. Okay. All right. So herd immunity. What in the world is this? So I'm going to respond via chat, but I want to give you all like 3 minutes. And I know you know what it means, and I want you to paraphrase it. So put it into your own words. So I'm going to give you 3 minutes. Let me put my little timer on and send your message out to everyone so that we can all see, because remember, we're not trying to remember things. Sometimes just because we've seen it or heard it so many times, we're going to automatically remember it. So we're trying to remember what herd immunity is. So for sure, send it out so everybody can see it, see your responses. If I can get my little clock up here, 3 minutes. We'll give you time to think about it. You may want to refer back to your notes if nothing comes to mind. Timer. So 3 minutes. Please share out, send it out to everyone. What is herd immunity? What is it? Is it important? What happens as a result of it? I'm just throwing out some stuff. Then I'm going to go on mute, so I won't interrupt your thought process. So far responses are good. I do need you to go back and add, how are they protected? What has to take place? So that's a piece that I'm seeing that's missing. So good, people are protected from an infectious agent. So go back and add, how are they protected? Okay, good. Got it, good. Y'all got it. Okay. 23 seconds, but you all didn't need the entire time. So let me stop my um little timer here. So yes, herd immunity is where a large part of that population, I think I want to say it's pretty close to like 90%. It's pretty much that, almost the whole population. But there's a small percentage that have not received that vaccination. They have not been vaccinated. And so as a result of at least 90% of people being vaccinated, that 10% is also protected. So because the people over, majority of the people have went in and got their vaccinations, it automatically puts a shield around everyone else in that community. So what happens? The spread of an infectious agent doesn't happen because that herd immunity protect those that have not been vaccinated. Isn't that something? It's like that's just a phenomenon. It's kind of like, what? Now, how is that happening? But that's exactly what herd immunity is. Thank you for your responses. You all were spot on. Okay. All right. So we have social determinants of health, SDOH. These are non-medical factors. They're non-medical, but they affect our health outcomes. So these are things that people that include like where someone was born, you know, where do they live at, their age, these are, it's not like the person that has maybe diabetes or hypertension. So these are like these are non-medical factors, but they really do affect someone's life, their health outcomes, particularly. Social determinants of health also include broader forces and systems that shape everyday life. Okay. Social determinants of health include an example that I have on this slide is our behavior. So now I want to stop and I want you to just kind of think for just a moment. What are some behaviors that are social determinants of health? These are things that determine someone's health, but they're social about them. Think about social things that are about our life. And I'm trying to give you a hint, but not trying to tell you what to put for your response. So my question to you is, what are some behaviors that would have effects on a person's health outcome? So just put an example in the chat and just send it so everyone can see. So we're talking about social determinant health. These are non-medical factors. These are things like, these are not like taking your blood pressure medication. This is not like, making sure that your insulin pump is working correctly. These are non-medical things. So what are some behaviors? My question to you, what are some behaviors that would, and these can be negative or positive, some behaviors that would affect someone's health outcomes? Okay. And I'll just do my timer for 3 minutes. So you can just kind of think about that. And the timer starts. Okay, so you all don't need that whole. We had 1 minute 44 seconds left, and so yes, all of your response. Make sure that you're looking at everyone's responses. That is correct. Those are some perfect, great examples. Exercising, not exercising, smoking, not smoking, alcohol use, not using alcohol. These are things that they do affect our health. These are some behaviors that do affect health outcomes. Good. Thank you all for sharing. Okay. So here we go. We just talked about social determinants of health. We've already talked about some examples. Okay. So that was our population health section. Are there any questions about that little part? Let's move on. So don't want to run out of time today, but I like to, do small groups and big groups and make it interactive and moving, but a little time is limited. So we're going to do a small group activity. It's not going to take long at all. We're going to talk about nutrition. We're switching gears here. Let's look at nutrition real quick. There's only, I think, about 4 slides. Okay, once we finish this activity, I'll make sure that we go over. We turn our little alarm off here. Then we'll make sure we go over the remaining activities. Okay, I was just looking at the other responses. So yes, those are good responses for the social determinants of health, our behavior, those non-medical things. So you will need your sheet of paper or just a little something to jot things down on here. All right, so we know older adults often have a diminished sense of thirst and maybe even appetite. So we want to encourage them to drink fluids or provide those reminders, about the fluids and the nutrition. Okay. Here we have Nurse Lisa and Nurse George. So we have 2 tasks in the small group, and I'll put you in a group in just a moment. So we have Nurse Lisa and Nurse George. They're headed to lunch. Nurse Lisa asked George, "Do you have your plate?" George states, "What?" So in your small group, just make a note, discuss what plate Lisa is talking about and what does that plate supposed to help you do. So I'll repeat myself. Nurse Lisa and Nurse George are headed to lunch. Nurse Lisa asks George, "Do you have your plate?" George states, "What?" So what plate is Lisa referring to? And then what is significant about that plate? So, all right, then the next thing that you're going to talk about in the group is, well, let's just do that. We can stop and do that. It's not going to take that long. Let's do 3 minutes. And how many are you on here? Let's do, okay, open the breakout rooms, accept the invitation. We'll give you 3.5 minutes. So what plate is she talking about and what's important about that plate? Accept the invitation. I'll bring you back in 3 minutes. Caitlin, did you accept the invitation?
I'm sorry, can you send it back to me?
Okay, let's see. Where were you at? Okay. My little mouse is acting like it's don't want to move. Okay. Let's see here.
I was in group 10, but wasn't nobody in there. Nobody was in there.
Okay. We will. Yes, someone fell off, so we'll move you over here to this other group. There we go.
Okay.
Yes. 1 minute left. 1 minute. So the whole point is to stay in the room to have your discussion, and then I'll bring you all back out at the same time. And so that it's a good conversation is had about whatever the concept is. But if you all are finished, that's fine. So, but next time I'll add those instructions too. So we have about 45 seconds left. Everyone should be back in about 30 seconds. Haley, are you trying to mute yourself? I hear a button. I can mute you if I need to. Okay, you got it. Okay. Four seconds, everyone should be back. All right. So just as a reminder, you all make sure that your first and last name shows on the screen, you all. Take the time to look. Make sure you have a first and a last name. If you do not, it might not be the same way on your end, but if you go to the right of your square, it says mute, unmute, and then there's three little dots. If you click the three dots, a menu pops out. Go down to rename and place your first and last name. Okay. All right. So let's go back. Nurse Lisa and Nurse George, they going to lunch. They are going to lunch. And Nurse Lisa asked George, do you have your plate? And George says, wait a minute. What is really going on? What is this plate thing? So I want to just gonna hear from the groups. Let's see. What is this plate thing that they're talking about? Group number 4. We have Town and Bunner. So okay, McNair started us off. My plate and portion. You took us on to that was a home run, McNair. So we got you. So a key recommendation, my plate is what we're talking about. And then the whole thing about that my plate is you don't really have to have your physical plate, but there are plates out there that when you're reinforcing, because remember we do reinforce education. And a lot of times in public health, you'll be out there. And these are conversations that people they want to know. They don't really, some people you'd be surprised and just think about what we really didn't know if we were not studying this stuff. That portion, we go in and I'm just thinking about, just think about what we ate for lunch today. How well were you within your plate? Did you meet all the colors and each portion size? So yes, my plate, a key recommendation is the whole idea is to watch those portions and so that we don't overeat. We don't overeat. Yeah, we're all, guilty of it sometimes, but that my plate, it reminds you to do the variety, the fruits, the vegetables, the different colors, and then watch those portions. All right. So hopefully you all had some conversation, and the small groups, they help you to validate what you know, and also do like a fact check. And then, be receptive of, if someone says, hey, well, I think it's, this. So then that helps you to, put that concept at the top of your list if you really did not know that answer. So those little small groups, they give you time to talk it out, think about it, then validate what you know. All right, so we're going back to the small group again, but I need you to jot this down. I'm going to share the screen. And then I need you to stay in the groups because I want to toggle around and listen to your conversations too. So remember, we're still talking about nutrition. Nutrition. What am I little PowerPoint? Oh, here it is. Okay, so we got Nurse Lisa. They at lunch, and George doesn't recall, but now he remembers because you all said my plate was portion control, don't overeat, have that variety. So now to fine tune things a little bit, they want to talk about some deficiencies. So a deficiency is having too much of something, just enough, or not enough. Deficiency. You can come off mute and tell me. If we are deficient in something, do we have too much or not enough?
Not enough.
Got it. Okay. So these are the vitamins that I want you to discuss. DK, iron deficiency anemia, and then protein. So, what are these? If someone is deficient in vitamin D, what could that potentially, what are some, when you go in to do your assessment, you're collecting subjective and objective data. What are some subjective and objective things that you might gather? And then also, what are some foods we're reinforcing teaching? What are some foods that a person would need to consume if they were vitamin D deficient, vitamin K deficient, if they have iron deficiency anemia, or they are protein deficient? Okay, I'm gonna put this in and I can broadcast it, but just do a jot note. You're talking about DK, iron deficiency anemia, and then protein. So I'm gonna put you in your breakout rooms, and you probably would need maybe 5 minutes to talk about these, because in addition to that subjective and objective data, we need to know what foods are needed to suggest to bring this person back to that normalcy state with these deficiencies. Okay, so you got to jot it down. We're talking about vitamin D, vitamin K, iron deficiency anemia, and then protein. A person that is deficient in protein. Let me set my little timer here. Let me reset it. And it's a small group. Like I said, you're probably gonna need maybe 4.5 minutes to talk about this, and we'll come back and share. Okay. All right, got it in your little jot note. And here we go. Go to the breakout room. We're talking about vitamin D, K, iron deficiency anemia, and protein deficiency. And then each group will share out this time coming back, because we're going to spin the wheel and we'll hear from everybody. All right, let me hit the timer and start.
I have no idea why it kicked me out.
Okay. So I'm going to move you. I got to move you one place, and I'll put you back in the room where you at right here, and move you to
Thank you.
there you go. Do you see anything? Okay, there you go. Let's pause. Okay, everyone should be back in 8 seconds. Let me spin the wheel here. Okay, so group one, let's see here. Who was group one? I'm gonna take you out, group one, so therefore you won't be, you'll be out of the wheel. Okay, so we have Sharp and Princess and Giselle. So tell us about vitamin D, particularly, and then end up with just tell us about vitamin D. What did you come up with vitamin D?
You want us to speak or to type it in?
You can go ahead and just type
Okay.
it. No, just go ahead and speak.
And
Our
speak.
time is
Okay.
gonna run out.
Princess, are you gonna do the vitamin D, right?
Sure, I can do vitamin D.
Okay.
Do you want me to do both of what it affects and what helps it, or do you want to do what helps and I do what affects it?
No, you do both. So
Do
that
both?
way,
Okay.
yeah,
All
it'll
right.
be easier.
I got you. Okay, so vitamin D affects your oh, I'm sorry, hold on. Going back to my notes, give me one quick fast second. Okay, vitamin D affects your bones, so it makes it weak or either makes it soft, so pretty much brittle. It causes bone pain and muscle aching. Pretty much just being fragile and weakness, and just having weaknesses in your body with your bones. Things that can help it as like food wise would definitely be good fatty proteins. So you can do salmon, you can do tuna. A lot of people don't like sardines, but you can do sardines. Egg yolks, mushrooms, and good thing about mushrooms, you got so many different of them. So I mean, hey, you got plenty of options. So yep, vitamin D.
Okay. So you all told us about the bone. How is it important for that bone health? So we don't know that the patient in 201 has this disease, but what disease is mostly known when someone has those soft bones?
Osteoporosis.
Osteoporosis. Good. And so what do we know is essential? Another vitamin that's essential for vitamin D to actually be absorbed.
Calcium.
Calcium. Good. Okay. Great. Thank you so much.
All right, thank
And
you.
you all did really well. Okay. So let's spin the wheel here. Let's see what we got next. The next one is vitamin K. Let's see here. Where that little wheel at? And just for sake of time, I'm just gonna spin the wheel, y'all. I'm not gonna share the screen. Let's see here. Okay, so it's showing number 9. Let's see, who was number 9? 9 was it was
We're number 9.
McNair and Jaeger. Got it.
Yes, ma'am. Vitamin K is essential for blood clotting. It helps wounds and prevents excessive bleeding. And it also supports bone health.
Okay, great. So what foods? What would you recommend a person to eat that is deficient in vitamin K?
Leafy greens like spinach, kale, collard greens, Lots of greens.
like broccoli, turnip greens, whatever greens.
Yeah.
Any meat in particular?
I believe again sardines would like fishes and stuff like that would be good.
And liver,
Liver.
leafy green
Organ
vegetables.
meats.
Got it. Great. Okay, so we're gonna have to pause, y'all. We're gonna have to take a 5-minute break because we get the whole 20, but we're not gonna do, we're just gonna do 5 right now because y'all are doing so well and we don't want to run out of time. So let's take a 5-minute break. We'll see you back. It is, what time is it now? Your time, it is 9 o'clock. So we'll see you back at 9:05. Let's just do a 5-minute break and we'll push the other at the end. So see you in 5. Remember, these recordings are still playing, so turn your cameras off and go on mute. Okay, so let's for recap. The My Plate focuses on a variety, portion control, and just making sure that person gets those fresh fruits and vegetables, but more so that portion control because they don't want people to overeat. We talked about vitamin D, and we're focusing in on like what disease processes that these if a person is deficient, not having enough of protein, if they don't have enough vitamin K, if they don't have enough of vitamin D, what are those signs and symptoms that we might, assess and find? What are those disease processes more than likely that we will see on their record that objective information chart obtained? For vitamin D, we said that vitamin D was essential for calcium absorption. And then we might see osteoporosis as a objective data, or that person may tell you subjectively, hey, I have osteoporosis, my bones are soft. And so we talked about vitamin K. It's essential for blood clotting, and foods that we would suggest would be, the organ meats such as liver and those leafy green vegetables, greens, turnips, spinach, all of those different things. All right, so now we're down to the iron deficiency anemia. I'll spin the wheel here. And then just keep in mind too, some of our fruits and vegetables and our meats, they do kind of maybe overlap. So this is group 8. So tell us about iron deficiency anemia. Let me go and see who was group 8. 8 was Anaya and turquoise. Did I pronounce it correctly?
Yes, ma'am, turquoise.
Okay. Iron deficiency anemia. What is going on?
Okay.
Subjective, objective. Go ahead.
Iron is essential for transporting our oxygen in your blood. And it supporting a healthy immune system. And when you have an iron deficiency, you could, let me see what I put forward. Did I put that down? Oh, fatigue or lack of energy. I'm sorry. I got so many notes I hadn't wrote over. Or like getting tired fast during exercise, shortness of breath. And foods like red meat are good for iron. Or any meat, protein.
Got it. So just think, hopefully the connections are being made. You all have had med-surg. You talked about all these body systems, what they're supposed to do, and all these different vitamins and everything. And so hopefully we are putting it together. You're seeing the connections when you talk to your patient. You're doing that head-to-toe assessment. But these are probably, and you look on that chart, or if the patient says, I have, this disease process, you're making the connection with the signs and symptoms that you're getting because it matches the disease process that they actually have. So yes, iron deficiency anemia, we do want to encourage those things like also liver. That's another one, that organ meat that and then spinach. Spinach is another one that falls in green leafy vegetables for vitamin K, but then also we encourage it for that iron deficiency anemia. Okay, so protein deficiency. Thank you all. Let's see. Spin the wheel here. Let's see who gets to tell us about protein deficiency. Okay, group number 2. And that would be, let's see who's number 2. Jacqueline and Quan. Taylor and Scott.
Miss Jackie, you want me to talk?
Well, I was just gonna read what
I think you went back on mute. Uh-oh. I think she's frozen.
every bodily function.
Miss Jackie, you were frozen for a moment. At least I didn't hear you. Maybe did you all hear? Okay, you all did. Okay. So
Reception.
okay, maybe I just didn't. Okay, go ahead.
Quan, you
Okay.
want to speak up?
Yes, ma'am. When I looked up the deficiencies, I saw that Lack of protein can cause fatigue, hair loss, dry skin. It can have blood clotting disorders. It can increase the risk of DVT, which is deep vein thrombosis, or PE, which is pulmonary embolism, and that comes from not eating enough meats or beans. It can also cause swelling in your legs and stuff like that. So,
Okay, again, hopefully you're making the connections when you are going in, assessing your clients, gathering that information. More than likely, when you turn to that chart, you look at that protein levels, probably the albumin level, those levels are probably going to be low. And so, sources would be peanut butter. Also, you all may have said this and I didn't hear you. Peanut butter and eggs, these are food choices that you want to encourage them to eat. What disease, and you all may have said this and I might not have heard you, disease process or finding would the patient have, or we need to more than likely check their protein level to see what it is, and then make sure, probably add protein to their diet, add an additional egg or peanut butter. In a lot of facilities, what they give, they have like these little protein little drinks. If we see a person has this, that we are also providing some type of care for. And I'm not fill in the blank. A person might have something that we're probably doing a treatment for, and they're probably, you need to make sure that their protein level is appropriate, because if not, it would lead to poor progress. I'm not trying to say the answer. What would we probably, a person might have what? And that protein level would for sure affect it with progress of it. A ulcer, a decubitus ulcer. So when someone has some type of wound, decubitus ulcer, or any type of wound, we want to make sure that their protein level, check to see what that protein level is, because more than likely, if they have a wound and that protein level is not where it should be, if it's deficient, then that wound is going to slowly heal. When we do the evaluation, each time we go in, like, this wound isn't changing. Well, and then that person might need that additional protein. And so they may add peanut butter. They try to add like those simple food items, peanut butter and eggs, pretty much everyone's accustomed to those. But those are items that they will actually add. Okay. All right. So let's move on here. Let's see. All right. So let's see. What are some myths that you have heard about the geriatric population? So is a myth something that's true, or is a myth something that's not true?
Not true.
Okay. So is it true or myth that the elderly, all elderly are cognitively impaired? They're probably oriented only times one or two, and they have difficulty thinking. Is that a myth or is that true?
You said that they all?
Yes. Just because someone is older, does it automatically, so test taking tip, if you read the question or scenario, reword it, but don't change what the question is asking. So I'm rewording. Someone that's older, 65 and older, will they automatically have a problem with cognition? Will they automatically not know who they are, where they are, the purpose for being there? Will they automatically have depression just because they're 65 and older?
No.
No. And so some 100 years old are probably more sharper than we are, it just depends. So no, just because a person is 65 and older, it does not automatically, you don't automatically sign up to be cognitively impaired. So what are we talking about being cognitively impaired? When we go in and ask them, who are you? Who's the president? What's the date? What's the year? That they automatically going to answer those things incorrect. That's not true because someone is older. That's a myth. And so what about all elderly live in nursing homes or long-term care facilities? Is that a myth or is that true? No, all elderly do not live in nursing homes or long-term care facilities. It's not even enough for all elderly to, there's not even enough nursing homes or long-term care facilities for them to live in. Most of them don't. Most of them still live on their own. They may change their setting. They may live in an assisted living or what do you call it, independent living. A lot of places, I want to say, like there are a lot of more places popping up around the country where these communities are 65 and older. So no, they all do not live in long-term care facilities. And is it a myth or is it a fact that older adults have are poor and don't have any income? Is that true or false? Okay, you all are putting it in the chat. Okay. So, and I don't know if you noticed, I went from myth to true or false. Because a myth is something that's not true. So that would mean a myth is false. So again, don't change what the question is asking you, but if you're reading the answer choices, you can say, is this true? Does this match the concept? Or is it false and it does not match the concept? So that's just another test taking tip. And when you're reading, make sure the entire statement matches. Is it either true or is it, false, depending on what the question is asking. So if a question asks you to select a statement or a scenario where someone needs further teaching, more than likely the statement that they gave you was correct or incorrect. If a patient needs further teaching, was that statement incorrect or correct? Or was that statement
Incorrect.
true or false?
Incorrect.
Incorrect or either false. Because if I need further teaching, that means something that I am stating is not correct. It's off point. It's not correct. But if I do not, if no teaching, no more teaching or further teaching isn't needed, then what I'm saying is correct. Okay. But if I need further teaching, that means something that I am stating is incorrect. Test taking tips. So you read the answer choices and look for something that is incorrect about the concept. So make sure that you're taking time to read the question and see what it's really asking you to actually answer. Okay. So ageism, most of the time the elderly experience it, but it can occur at any age. Ageism is like a prejudice or discrimination against a person based on their age, like the myth and truth thing we just said. Well, this person coming in, my patient's coming to the urgent care center today, they're 70, but automatically thinking that they don't have insurance or they're not able to pay for the services that they're being rendered, or thinking that they're not going to be oriented to who they are and where they are. So, and then that can have a negative effect on a person's health outcome. Ageism could lead to worse or either negative health outcomes. And and what it does, it leads to that patients, whatever reason they came to you for, that's those signs and symptoms or that disease process, it leaves it being unmanaged. And so because people are already thinking, well, this person they're 70 years or 71 years old, they should know everything, or we're not going to give them as much attention or care as we would someone that comes in as 25. And so that ageism can have that negative effect on health outcomes. And then as a result of it, a person will have worse health outcomes. So let's talk about the baby boomers, the Gen Zers. So baby boomers, what years of birth? What years were they more than likely born in? Or how old would they be? So you can do the years for baby boomers. If we're referring to someone that they are a baby boomer, they're probably born between what years and what year?
1946 to 1964.
Okay. If we're talking about Gen Zers, who are we talking about? What's that year of birth?
97 to 2012.
So those are the young babies. Yes, so they're a little bit younger. So those Gen Zers, yes. Okay. So advanced directives, are these legal documents? What is an advanced directive? And advanced directives usually composed of two documents. It can be that living will and it can be that dual power of attorney. A person can leave a person in charge of making decisions for their health, and then a person can leave in writing what their wishes are. And yes, these are legal documents. And I'm not sure if you all have, when you're going through the patient's records, you've seen some of these documents, but they're legal. So in the event that a person has someone in charge, in the event that they can't make those decisions, that person makes those decisions, and we go with whatever the healthcare provider will grant the wishes of who that person is, because that advanced directive, these are documents that include the living will and the dual power of attorney, which that person can have a dual power of healthcare, a dual power of finances, but nevertheless, they're leaving their wishes known either via someone or in writing. Are there any questions so far about what we have discussed so far? If not, we're gonna move on. We'll move on. So emotional abuse, actually, what is that? What is an example of that emotional abuse? Because we know physical abuse involves the action of causing physical pain or injury to someone. And then neglect is a passive form of abuse in which caregivers fail to provide the needs for that person. So getting them to the doctor's office, making sure their clothes are clean, the meals and all of that. But what is emotional abuse? Or give me an example of what emotional abuse is. Let me check the chat. Okay, good. Good. So emotional abuse often includes behaviors such as isolating that person, ignoring, and depersonalizing, make it like yelling at them. Behaviors that makes that person not feel like a person. Financial abuse is using those finances, using their debit card or whatever means of monetary things that they have, using those resources, either stealing them or misusing them. They send you to the store to purchase, I don't know, a bag of apples, some bananas, and then you come back with the person comes back with, I don't know, chicken liver. What were those things we were talking about? They come back with liver, peanut butter, eggs. So that is not what they sent their money. Those are not the items that they wanted their money to be used to be purchased. So yes, that is financial abuse. And abandonment occurs when a dependent older person, they are deserted by the person that's responsible for their custody. Because there are some older people that they're in the custody of another person. So if that person leaves them and does not provide the care for them, that is abandonment. We did say physical abuse occurs, can occur in many forms. Someone physically attacking that person, causing harm to that person who cannot actually fend for themselves. And then some signs of physical abuse. Remember, we said last week that was like bruising of different stages of healing. Those bruises usually turn those different colors. Like, okay, the bruise is this color. This bruise just happened. But this bruise is, this color. That bruise more than likely has been there for a while. But nevertheless, that is a form of physical abuse. We are mandated reporters, so we need to report to the appropriate authorities. We do not have to confirm and know all the details if we suspect that someone is actually being abused. But we do need to know what your state laws is. If whatever state that you're going to be licensed in, you do want to make sure that you know the state laws pertaining to abuse and who are those appropriate authorities that you should contact. Even if you're working in long-term care facilities or at the hospitals, if something happens at those facilities, you do still report it to those outside authorities. A lot of times the police has to come in. It's like, well, we at the long-term care facility, why would the police have to come in? Because those are the appropriate authorities. Depends on what happens. And then once the whoever those responsible authorities, they come in, they have been notified, they are obligated by law to investigate. We don't have to do the investigation. We may be a part of their investigation where they'll come back and interview us, and they may ask us to write out statements. But once we report it, they are obligated to do the investigation part. Okay, and are there any questions? We talked about physical abuse, emotional. We talked about financial abuse. I know on the TV they tell you this. What was the thing that they were talking about the other day? Where in terms of financial abuse, where these scammers are calling people and getting them to give them their passwords and things like that to their accounts, and the people are missing large sums of money, but usually they do have the people in these banks that are sitting there watching all these different transactions and everything, but that is a form of financial abuse. We did say that we were mandated reporters, and we don't have to know all the details, but we do need to report if there's a suspicion of it to the appropriate authorities. And you do want to know your state and as well as your facilities, policies, and procedures so that you can proceed accordingly. Okay. Are there any questions so far? Because now we're just reviewing content from last week and this week, but I just want to make sure that enemy check the chat just to make sure. Okay. Got it. Good. Got it. Okay. So when we check on our patients every 2 hours, is that the only time we can check on our patients every 2 hours? Nope, that's at a minimum. At a minimum, we can go in. Most of the times you're going to interact with your patient more than that anyways, but at a minimum, we're going in every 2 hours. So the answer was no, we usually interact more than that with our clients. So we were talking, I mentioned the adult daycare center earlier, but it had those identifying those resources, adult daycare, and there are some wellness centers too that have different programs. These will, when you're retired, most people, once they retire, when they really retire, they always, a lot of them say, well, I don't have anything to do. So letting them know about the community activities. This can, reduce their feelings of isolation as well as help their emotional well-being. So identifying all those different programs that are out there. As a matter of fact, a lady mentioned it the other day. It was some walking program. I was like, wow, I didn't even realize that it exists, but it's for those that are retired. They're all different types of programs. So that's when we were talking about those social determinants of health, those non-medical things that affects people's health. And so being a part of that walking program, it could have a positive impact on someone's health. Okay, I'm just reviewing my notes now, just making sure that we have covered everything. Is there any concept that we are unsure about? So we're talking about the herd immunity. We do know they started talking about September, well, probably late August. You don't hear it as much now, but pneumonia and flu vaccines, they push pneumonia vaccines pretty much all year because you can have those, but particularly the flu vaccines, they start talking about those. So, just having that information there, hopefully, will prevent, But the only thing about that is you can hear people say, well, hey, I got the flu vaccine, I still got the flu. When we provide that information that, you do want to receive it in a timely manner. So in the event that you do come in contact with one of those viruses that's actually in the flu vaccine, because not all flu viruses are in that vaccine, it's only the ones that the scientists pick out. So in the event that you come, for example, if there are 5 that's in the vaccine, you come in contact with one other that's not in there, yes, you can still get the flu because you're not being protected against that particularly strand. And then we want to encourage people to receive those vaccines in those timely manners, when it's really due. So usually May and June, you don't hear about flu vaccines because that season has run its course. And it's not really needed then because people still get the flu, but it's kind of rare. Okay. All right. So we didn't take our other 15 minutes. I will go back through all the content and just do some tidying up here. But if there are no other questions, you are free to go because we didn't take our 15-minute break. We had a total of 20. We only took 5. So, but make sure just as soon as this video that has to download and upload, I'll post it. Make sure that you go back through our classroom recordings and those live exam review links that are out there. And be ready on next week for exam 1. Take care and we'll see you next week. You're welcome.
Professor, when will we know if we're gonna get the request for proctoring approved?
We should know pretty soon. Our exam is Wednesday. What's today? Wednesday?
Right.
Yes, for sure by Friday they should have everything worked out.
Okay.
Because on your campus is your dean. Let me just pause it. There are some preventative resources or interventions that are recommended. For example, the herpes zoster, the shingles vaccine. It is recommended for those that are over 50. Mammograms are usually recommended at a minimum of every 2 years, but for the most part, they do those screenings every year. But there are some that elect to just get it every other year. But that's at a minimum every 1 to 2 years. People are getting those mammograms done, and these are interventions that we are screening to determine if there's follow-up that needs to be done. Okay. So health promotion strategies, these are practices that we are recommending so that a person can maintain their wellness. And so that would include, we talked about that My Plate, making sure they eat that appropriate portion sizes, regular exercise, alcohol, either none or very little, and just staying involved for that good well-being, just staying involved, being involved in activities, having that interactions with others. And so in the event that a person, on the flip side, a person does not have good health maintenance, we usually would see those physical limitations, and they may have altered cognitive or they may have altered cognitive responses. So physical exercises, water aerobics. I don't know if that pickleball thing is a new thing that's back on the rise. So But the whole idea is those non-weight bearing exercises, they increase strength and flexibility while improving cardiovascular health. We do another preventative intervention is making sure that our clients, our patients are being seen by the dentist, the foot doctor, because we do know poorly fitting dentures, they can cause irritation to the gums and the mucous membranes in the mouth. And then what happens as a result of that? That person does not consume the calories and things that they don't want to eat because their mouth hurts. And so they need those dentures because we know the teeth, they break down that food. So making sure that they have those regular follow-ups with the dentist, and for sure if they have dentures, make sure that those dentures actually fit well. So there are many of us on the healthcare team. We a lot of times will be interact and talk with a social worker because they're the ones that help us to identify all those resources. For example, Meals on Wheels, they have programs that assist with prescription assistance. You know, most of the elderly clients, some of them are on fixed incomes because, you know, they're not working. Most of them are retired. And so medications can be expensive, but working with that social worker, they can help identify programs that will assist with medication assistance, with nutrition. They're the ones who can identify those different programs that are in the area. We do want to encourage our clients to participate in activities, whether or not they're at the adult daycare center or at the local community center, because we want to decrease or reduce isolation, because in being involved does improve emotional well-being. It really does improve emotional well-being. Chemical restraints are when medications are administered to purposely alter or prevent a client from being able to respond. Physical restraints is a device that are used to keep that client from moving. So side rails, if all four rails of the rails are up on both sides, that's an example of a restraint. And so side rails are considered a restraint. Administering medications, for example, a patient is on pain medication, and usually pain medication slows someone down because it alters those receptors. And so that person usually, gets drowsy. But if we're administering if a nurse is administering that medication for a reason that's outside of why it is prescribed, then that is a chemical restraint. We do want to prevent falls, so making sure that the clients have those rubber sole shoes on, checking those walkways, performing those regular safety checks, and we want to identify potential hazards. So that is making sure, look at those shoes. These are slick bottom shoes. No, we want to discourage them from wearing those shoes. We want those gripper sole shoes. Throw rugs, making sure lighting is appropriate. We want to identify those risks and those hazards, because the effects of falling. Someone falls, they break a hip, they have to go through surgery, the time to heal. So those effects, things that come after someone's that falls. Throw rugs, you have to be careful with those, because if they don't have that non-slip padding, then those things, they move. You step on a rug, it'll slide. So as a result of that, a person has an increased risk of falling. So if a person needs an assistive device, cane, walker, crutch, wheelchair, to assist with their balance, then that is a resource. Those are some resources that we will work with that social worker to obtain for that client.